Welcome to The Explainer. Today, we're diving into a really fascinating idea. It's all about building a better healthcare system by creating something called an empathy engine. So, this whole idea really kicks off with this quote from Dr. Lev Neymotin. He'd just designed what he thought was a game-changing medical device, but then he had this startling realization. In all the meetings with all the experts, the one thing they weren't really talking about was what the patient was actually going through. And that brings us to the central puzzle of this whole thing. I mean, it doesn't make sense, right? If you've got a better, safer, faster way to help people, why wouldn't everyone jump on board immediately? Let's get into it. Okay, let's start by looking at the specific case that lit the fuse on this whole idea. It's a classic story. A brilliant invention meets a surprisingly lukewarm reception. So check this out. Dr. Neymotin creates this thing called DupuyFix. It's a high-tech fix for a condition called Dupuytren's contracture. Basically, it's where your fingers get stuck, curled into your palm, making simple, everyday things almost impossible to do. And DupuyFix, it's a robotic, AI-powered system designed to treat it with incredible precision. And you'd think this would be a slam dunk, right? I mean, look at the advantages. It's less invasive, way more precise than doing it by hand, which means a lower risk of hitting a nerve or a tendon. It's faster for the patient, and it could even end up costing less. On paper, it's an absolute no-brainer. But here's where the story takes a turn. When Dr. Neymotin presented his invention, the reaction wasn't excitement. It was kinda meh, just mild interest. All those clear benefits we just talked about were getting pushed aside by something else. The big question was, what was it? The answer he landed on was something he calls the empathy gap. It's this giant chasm between the person who's actually living with a medical problem and the person who's treating it. And wow, when you lay it out like this, you can really see the problem. It's like two totally different worlds. In the provider's world, you've got routines that are already set, professional pride in your manual skills, and billing that, well, it works. For them, the way things are is good enough. But then you look at the patient's world. It's a daily grind of inconvenience, real dangers from not having a firm grip, huge delays for treatment, and just constant discomfort. They're not even looking at the same problem. And look, this isn't just some vague, fuzzy feeling. This gap shows up in really concrete ways. It means the urgency gets underestimated. A 3-month wait doesn't feel so bad if you're not the one living with it. It creates what you could call procedural inertia, a resistance to change because the old way works. And it leads to this systemic detachment where big policies get made by people who will never actually feel the consequences. So, if the problem is a lack of felt experience, how do you possibly fix that? You can't just tell someone, hey, be more empathetic. The proposed solution is pretty radical. You have to actually train them to live through it. This is Dr. Neymotin's core idea, patient experience-based medical training, or PMT for short. At its heart, it's a training program where doctors, nurses, even administrators go through these super immersive but totally safe simulations that let them feel what a patient's condition is like from the inside. Honestly, the best way to get it is this analogy. We don't let a pilot just read about engine failure, right? No way. We put them in a flight simulator so they experience it over and over. PMT is basically that, a flight simulator, but for empathy. It lets a provider feel the patient's reality in a safe way so they truly get what's at stake. Okay, so this sounds cool in theory, but how does it actually work? Let's get practical and look at the actual training module designed for that DupuyFix device we were talking about earlier. So it's not random, it's a really structured 4-step process. First, a briefing on the condition. Then comes the key part. They wear a device that simulates the hand impairment for 12 to 48 hours straight. While they have it on, they have to try and do these specific real-world tasks. And finally, and this is probably the most important part, they debrief and talk about what it means for how they practice medicine. So what does that actually feel like? It's not one big dramatic thing. It's the accumulation of 1,000 tiny frustrations. You know, trying to button your shirt when your fingers won't cooperate, fumbling with your keys, the sheer difficulty of trying to type an email or just hold a cup of coffee. It's that constant, grinding stiffness made real. And this is the whole point. After just 24 hours of that constant frustration, the idea of telling a patient they have to wait 3 months for a simple 5-minute procedure that could fix all of it, well, it suddenly stops feeling like a normal scheduling issue and starts feeling completely and totally unacceptable. But hey, this idea is way bigger than just one condition. Imagine an ER doctor. What if they spent a day in a simulation that restricted their mobility, muffled their hearing, and really made them feel the vulnerability of a trauma patient?
Or what about an ophthalmologist? They could wear special goggles that simulate the cloudy, frustrating partial vision of someone with cataracts. You have to think that would change their sense of urgency.
And get this, it's not even just for the clinicians. Picture a hospital administrator or an insurance exec having to go through their own system to get approval, all while a simulator is making them feel the symptoms of the very condition they're trying to get treated.
So when you zoom out and put all of this together, you realize it's not just about a new training module. It's really about creating a whole new kind of doctor and a whole new kind of healthcare. The big picture vision here is a system where empathy isn't just a nice-to-have soft skill, but a core trained competency. A system where that lived, simulated experience leads directly to shorter delays, to faster adoption of patient-friendly tech like DupuyFix, and to policies that are actually built around a patient's quality of life.
And let's be crystal clear about this. This isn't some appeal for doctors to just be nicer. This is a hard-nosed, practical argument for better medicine. Because empathy that's born from real experience doesn't just improve bedside manner, it leads directly to better, faster, and safer results for every single patient. Which leaves us with this final, really provocative question to think about. We train surgeons for thousands upon thousands of hours to perfect their technical skills. So, should we be training empathy with that exact same level of rigor?